So it is July 5th, and here in Germany, where I am at, it's almost 10 in the morning.
Yep.
I am Laura Maria Caldarone. This is 14 Days to Change, and with us we have Recruitment Advisor Beth Preston, all the way from New Zealand.
Hello, good evening.
Hi, yeah, time difference still there. Hi, Beth. So you are our 9th story in this series, but it's actually the second time we've spoken. It's our second interview because the first one was actually 2 weeks ago, 14 days exactly, on the 21st of June. And, you know, before we kick off this interview and speak about what is happening right now in New Zealand and also the UK, because although you live in New Zealand, you're actually from the UK, so we'll see both perspectives. Let's do two things. The first one is I'm just going to remind everybody how New Zealand has changed in terms of numbers, so what the numbers were back on the 21st of June and now. And then the second thing is I'd like to show you bits and pieces of what we spoke about back then and we take it from there. So first, the numbers. On the 21st of June, when we first spoke with Beth, there were 5 active cases at that time. And in total, New Zealand, since the beginning of the pandemic until the 21st of June, had 1,509 cases and 22 deaths. Now, 2 weeks later, 5th of July, there's actually 21 active cases. So there has been an increase, which we'll talk about that. And so in total, the cases have been 1,533. The deaths, thankfully, but obviously also sadly, have stayed 22. So still 22 deaths. That is good, hasn't changed. That is bad because it happened. And I'm not going to say the UK numbers because maybe we don't want to hear them. But no, seriously, I'm not going to say them just so we don't confuse too many number information, but we do know there are changes and we will talk about them. So, Beth, let's hear a little bit about what we spoke, but also let people know who you are. So I'm going to ask you to go on mute. I'm going to share my screen. You let me know that everything is good with the screen sharing, because I've had issues. And you should be able to see and hear. Beth, please tell us about yourself. Just who are you?
Well, as you said, I'm Beth. I am originally from the UK. I grew up in Huddersfield, which is in West Yorkshire, but lived in Brighton on the south coast for about 8 or 9 years before I moved to New Zealand, which is where I've been for the last 3.5 years. I live in Hamilton, which is really close to Auckland, so close to the top of the North Island. And I live with my partner. We've got a lovely dog called Norman. I am a recruiter by trade, but have lots and lots of hobbies. I like hiking and cooking and exercise and singing and performing. So yeah, I'm a very busy girl.
Awesome. So, and how, you know, I've never been to New Zealand. How is it? How's the change from UK to New Zealand?
It's amazing. Yeah, I will probably be here forever. It's one of the best decisions I ever made. It's very similar in terms of culture, but everyone is much more relaxed in the way they do things, and much more, I think, accepting of people's differences a lot of the time. And it's just a much more relaxed way of life.
Okay. Yeah. So why not, right? It's really...
Yeah, exactly.
Can you tell me just what is happening in New Zealand right now? So what is the most important thing? What's the topic? What's the news that everybody's talking about or is concerned about? Just tell me a little bit about that.
Yeah, so we of course reached 0 cases about a week and a half, 2 weeks ago, and went down to level 1, which is essentially normal life, but with border controls still. But the border controls have been relaxed. So there are New Zealanders coming back from overseas that weren't able to do so over lockdown. And there are people coming to New Zealand for compassionate reasons, so funerals, whatever. So there are more people coming into the country, and so now we have started to get cases again. So the first 2 was 2 English women, and they were allowed compassionate leave from quarantine to go to a funeral, but they hadn't been tested. They saw people along the way, and it was a bit of a disaster. Luckily, it doesn't look like they passed it on to anybody, but they tested positive. And today we had our 6th and 7th case, so we've got 7 now.
And
but
they're all important.
They're all big. Yeah, so they're all from overseas. So we've had 2 from the UK, 2 from India, I think, 1 from Pakistan. Yeah, so they're all people coming in, and initially the quarantine I don't think was being managed particularly well. But now, of course, because there was that breach and everyone's suddenly like, oh my God, this could be the second wave, it's being really well managed now. So we're likely to see more cases as more people come back, but everyone's feeling a bit nervous because going from 0 to having some again is a bit scary.
Especially because your lockdown was pretty intensive, right? Very harsh, let's say. So you did your part, and I assume it's a bit. I mean, you were in a good streak, right? 0 cases. I think 25, 26 days, if I'm not mistaken.
It was 24
days
that we had none. Yeah. But it's bound to happen as soon as you let people back in. There is still a pandemic raging over the planet. Just because we're doing quite well doesn't mean that the rest of the world is. So if people are coming in, then the chances are some of them will have the virus.
Exactly. What are your hopes? What are your concerns? What is it that you think is going to happen in the next days, in the next weeks, either in the UK or New Zealand, or even both? And what is it that you obviously don't want to happen, or you would like to happen? Just a little bit. What are your constant thoughts on this?
So I guess my worries at the moment are that there will be a second wave, because it's a real possibility. We all in New Zealand kind of felt bulletproof for a little while there because we had done so well. And then suddenly it's like, oh no, this could actually happen. Be careful. So I'm keeping a wary eye on what's going on there. And I mean, as for the UK, I don't think anything is going to calm down until there's a vaccine, realistically, because it's been handled so poorly. My hope is that there is a vaccine soon, because I was due to go back to the UK for a month last week. So I was supposed to leave last week, and obviously can't. So I really, really hope that in the next year and a half, whatever it ends up being, that I can go back, because I really, really miss my friends and family. So yeah, just cross fingers that the scientists are doing a really good job.
Yeah, I think that's what everybody is hoping. No, it's the hope that unites us, I think. But let's see. Let's really see what happens. And like you said, New Zealand and the 5 million people did very well, and I'm sure you can continue, right? They can continue. And just to finish our conversation, just a little bit philosophical.
Mm-hmm.
If you could give a message to Beth, to yourself in 14 days, what would you tell her?
Oh, that's a really difficult one. I would tell her to not worry. To don't waste the next 2 weeks worrying, because actually worrying doesn't do anything. And you're not going to change the outcome of anything by worrying. So just have fun and be sensible and be kind.
I like that. Be sensible, be kind, and yeah, I like that. Well, Beth, thank you very much for spending
Thank you.
your evening with me and my morning.
My pleasure.
And yeah, it's been really lovely talking to you about New Zealand and a little bit about the UK. And we will see each other in 14 days.
I look forward to it.
Thank you. Bye-bye.
Thank you. Bye.
So, Beth, that was you 14 days ago. And this is the first time you see bits and pieces of our interview on the 21st of June. What are your impressions? What are you thinking? Be sensible, be kind. That was your message to your future self. And
yeah. Well, firstly, I want to apologise for the terrible camera quality. I used my partner's laptop and it was like filming on a potato. So here we are. You can actually see me now, which is good.
Your own.
That was really funny to watch, actually. I had anticipated that I might win, but New Zealand has continued to handle things well, which negates the worry. You know, I think I mentioned there, you know, lots of people coming into the country, and I said it's people who are New Zealanders, and it was a bit scary because the quarantine had been managed poorly to begin with. But now we know it's being managed really well. They have upped testing. They've almost tripled the amount of testing they're doing, and there is zero community spread. So that's really reassuring. But yeah, I've had a lovely 2 weeks since. I didn't worry at all. So that's good.
See, that's good. And like you said, it does negate your worries, what you were saying for New Zealand, but unfortunately not for the UK.
No, not for the UK. I mean, I think I've said to people in the past, it's like watching a car crash in slow motion. In the UK, it's just the way it's been handled is just so frustrating. And the fact that today they reopened the country when there are still thousands of people dying, just so people can go to the pub. It's just mind-blowing for me. Yeah.
Like, just stay at home, drink at home, and especially because I'm not saying all pubs, but many of the pubs, at least the ones I know and have seen in the UK, in London, etc., they're quite small.
Well, yeah, they're most of them are really old like cottages, or, you know, minuscule little rooms. And, you know, I know when I'm drunk, I don't respect people's personal space. And, you know, I see myself as quite a respectful person. So you add the amount of people that there are in the UK into the amount of pubs that there are, no matter how much you try and socially distance people by 1 meter, it's going to spread. There's just no doubt about it.
Which, that's another thing. You mentioning the 1 meter, that's not how it was a few weeks ago or a week ago or so on. The policy has changed. They've shortened the distance, but the virus didn't get lazier, right?
The virus doesn't care that, you know, you want to now stand close to your friends and you want to go to the pub. It will still travel. We have a microbiologist here in New Zealand called Susie Wiles, and she's this wonderful scientist. She's got bright pink hair. She's on the TV all the time. And at the start of lockdown, people were having, you know, driveway meetings and drinks and whatever, you know, staying 2 meters apart at least, but still meeting, so to speak. And she said, please don't do that, because if you sneeze, it will travel 8 meters, or it can travel 8 meters. So 2 meters when you're out and about is for the best, you know, safety wise, but if you can, it needs to be 8 meters. So pack everyone into a pub and you're just asking for trouble.
And changing the policy like that, it also adds to the confusion that the UK and other countries, but the UK especially, has had from the beginning of communication, right? The communication skills have been lacking, unfortunately.
Oh yeah, I mean, we've been very lucky because Jacinda Ardern has a communications degree. You know, previous prime ministers have had, you know, economics or finance or whatever, which are all well and good, but actually this has proven that a communications degree is a very worthwhile thing to do because she has handled this so well. And I mean, in the UK, there's been memes made about Boris Johnson and his message because it just doesn't make sense. There's no clarity whatsoever, and you know, you give people an inch and they will take a mile, particularly when they're feeling frustrated. So you know, you say people can stand a meter together, they'll be having hugs all over the place.
Yeah. Especially because you're not really explaining your logic. I mean, I haven't seen anything where Boris Johnson, Prime Minister Boris Johnson, and his advisors say, you know, there is a logic. We have seen X, Y, Z, and that is why it's no longer 2 meters, but it's 1 meter. I haven't seen any reasoning. So then people start thinking, wait, does that mean that I've been wasting my 2 meters these months? Or
exactly.
Makes it
Whereas
worse.
here in New Zealand, it's been, this is why we're doing this. This is what being advised by our health people. This is the reasoning behind it. This is what we expect from you. You know, everything has been laid out totally black and white. Whereas the UK, it's just been a rainbow.
Too much of a rainbow, especially because from the very beginning, I remember even when Italy started thinking, okay, how do we reopen? Because obviously it's a given. It is a fact that economies have suffered from what, 99.9% of the countries in the world. We know that. And but in reality, this pandemic was never about, okay, it's either economy or health of your citizens. Unfortunately, somewhere along the lines, the narrative just focused on that. And so people thought, okay, it's either or. But no, first of all, they're linked. You cannot have an economy if
everyone's dead.
If everyone's dead or everyone is afraid because they understand how serious it is. And will you go? I mean, in New Zealand, yes, but I haven't gone shopping. I haven't gone shopping since end of January, beginning of February, actually. Supermarket wise, I've gone 3 times petrified to the supermarket.
Wow.
Every other time was online. But shopping, like I see some people like going to buy a shirt, a t-shirt. I have t-shirts.
Is that important? Yeah.
I'll wear a dress. I don't know. You don't need that. Obviously for the store, for the chains, yes, it's good. But in Italy, for instance, just to not lose too much of my train of thought, when they started thinking, okay, how do we open, right? They started thinking, is it by regions and so on? There is a reason. It's because you can't just open in a whole country or areas and have them mixed, right? Because that's another thing that's happening in the UK, in the world also. The EU borders are opening, and the UK until the end of the year, so 31st of December 2020, they will be considered as EU nationals. So they can travel freely everywhere. And some countries, like Greece, have said, no, the UK is not welcomed until the 15th of July. They might prolong it, I don't know. The UK and Sweden, so it's not just to target the UK, but other countries no. So that means they can go freely to, let's say, worse hit areas like Italy, like Spain, not quarantine, because that's the other problem, right? Who's going to go on holidays if you have to quarantine for 14 days? You don't. And so governments are saying, yeah, let's forget that little piece of evidence and, you know, just come, or show me a test result of 7 days ago, of 24 hours ago, of 3 years ago. Even one that is from 1 hour ago, it's not solid, right? It's
No,
not.
particularly if you're traveling, going through airports where there's thousands of other people traveling through there a day. You know, viruses don't care if you want to go on holiday because you're bored or because your economy's dying. You know, like you say, it's not economy or life. If you don't have people, you don't have an economy. So yes, we're going to go into a recession. There's no doubt about it. I mean, we're already there. But as evidence, New Zealand is bouncing back much quicker than we expected. And we will bounce back much quicker than the rest of the planet.
Yeah. Yeah.
So to watch that, you know, this travel happen around the EU, and like you say, people going shopping in countries where there's still thousands of people dying every day, it's just mind-blowing.
Yeah. I mean, obviously, now when we see, even take as an example, New Zealand, right? What works and what is happening in one country, obviously, is not the same in another country. But you've got to know what's happening in your country. You've got to know what's happening in your community, in your city, in your town. So if the transmission rate is above 1, that is quite high. That means that you are infecting more than one person. It is harder to track, to trace, to figure out how many, how, you know, when. And so, but if you're from a region, I don't know, in Scotland, let's say, where the transmission rate is barely there, it's below 1, you've only had, I don't know, 4 cases, no deaths, the last new case was like a week ago, then the risk is much lower. So there you can think, you know what, I want that shirt, I'm gonna go get it. And
yeah,
it's fine, the probability is low. But if you're in another city, in another town where it's above 1, above 2 even, and you're not wearing a mask, and you're not socially distancing, and you're crowding a pub or a store, it's, I don't know, it's playing too much with fire.
It's crazy. I mean, here, you know, in the last 2 weeks, I've very obviously been to the hairdresser. I've performed in front of an audience of about 150 people, all crammed into a room. I've gone shopping. I've done all of those things, but because I'm able to, I didn't do any of those things when there was a risk. And then, for example, Melbourne in Australia, they reopened too early, and now they are having a huge second spike. And so they are fully locking down. I think they're doing it area by area. So areas that are particularly bad are going into full-blown, you know, army managed lockdown. Others are going into, you know, socially distancing. But you know, just because New Zealand is doing well, Australia shouldn't start doing all of the things that New Zealand is doing. And because New Zealand is doing well, the UK shouldn't open, because there are still thousands of people dying.
And you just said it, just because New Zealand is doing well doesn't mean another country needs to just open up, but also you need to look at why New Zealand is doing well. Just don't look at the present, but look at all the weeks and the months and the suffering, but also the sacrifices that every single person, or almost every single person, has done, right?
Yeah.
This brings me to a topic a little bit random. So social media, right? Social media can be amazing, but it can also be really messed up. And
hellfire.
Yeah. Before the pandemic, but especially now because of the pandemic, right? You can find an escape that grounds you, depending on what you follow and what you see and what you interact with. But at the same time, it can just feed your, I don't want to call it the lies that you've told yourself, right?
Yeah.
Because that's basically it. There are people that are still saying that this pandemic is a hoax. There are people that are still saying that the virus is inexistent or it's just a flu. There's still
Scamdemic.
exactly. There's people that are still saying all these things that, unfortunately, and that's the heartbreaking part, and that's why it's scary, they're not true. This is a real virus. This is a real pandemic. By definition, a pandemic means, hey, there's an emergency. It's a health global thing happening everywhere. That's why it's a pandemic. And it does affect a lot of people. It affects everything. People are suffering. People are dying. And it's not a flu. Because if it was a flu, who on earth would do this? Like, when would all these things that are happening and have been happening would happen, right?
Well, but everyone lives in an echo chamber, right? So they think that everyone's being forced to stay at home so that we can be controlled by the government, and I can't remember what they call it, but and then they say, do your own research, wake up, sheeple. And it's like, I have done my own research. I've just not listened to some crazy on the internet.
Yeah, I'm not just watching some YouTube video and saying, okay, yeah, that's science. No, I'm actually looking, and not only at your own country, right? Not only where you're living,
the whole world,
the whole world. And there's also Google Translate, DeepL. You can you don't have to even speak the language. You can actually have quite a good translation. 2020, these Google Translates and etc. are good enough to get the gist of what is happening. The reason why I bring this up, before we get into too much of the pros and cons of social media and the crazy things that we are hearing, I just want to focus on one crazy thing. So I was reading an article, and I'm the type of person that reads the comments. I always read the comments.
Yeah.
Sometimes they frustrate me, but sometimes they actually, make me think and then make me wonder. And that's how I read another article. And obviously what I follow and what I read is all pandemic. So epidemiologists, virologists, scientists, government, philosophers. I even have some philosophers in there. So very big spectrum, but very focused. And I was reading this article about the situation in the United States, which is another one that in these last 2 weeks has
scary.
Yeah. It's a big car, right? Crash. And they were saying, what was happening and so on, and how certain states, governors had basically changed their narrative. Whereas weeks, months ago, they were saying masks are not needed, everything's fine, just go ahead and shop, and it's just, this party that is exaggerating, so politicizing the virus. Now they're saying, you know what, science says wear the masks, you should wear the mask, things are getting bad. Again, that feeds the confusion, and you still need clarifications, right? Clarity. You still need a communication degree. And one of the things I read was somebody answering somebody else saying, if you don't wear a mask, you are just helping COVID-19. You're helping the spread, and it's just going to make things worse for our healthcare system. Look what is happening in Houston. Texas is one of the worst hit states right now. And we knew that. We saw it was going to happen. The comment below it, responding to this comment, that it's very simple, very factual. If if things get worse, our healthcare system gets worse, and then we're in trouble. We've seen it everywhere, from Italy to China, that built a hospital, 2 hospitals in 10 days. There's proof. Their comment was like, we were supposed to watch New York, we were supposed to watch New Jersey, that was going to be our future. whatever, just make sure that the governor in Texas does not send sick patients to the nursing homes. That is true. You should not send sick persons, say, with people with COVID-19 back to the nursing homes, because we've seen in Spain and other countries, the UK, nursing homes are very badly hit.
The worst place for them to be, yeah.
Exactly. We've had a lot of losses because of everything, just the conditions of not responding correctly to what needed to be done, but also the age, right? A lot of people that live there are very old, hence the nursing home name, and they have pre-existing conditions. So it's the two things that the virus likes. But then the messaging changed a bit. It says, we were supposed to watch Japan and Australia and New Zealand, and look at them. They're all doing fine, and they're doing fine without masks and without lockdowns. It is all fake. And that's when I thought, Beth, I am going to talk to Beth about this.
We're doing so well because we had the most restrictive lockdown one of the most restrictive lockdowns in the world. We couldn't leave our houses for 6 weeks. Just because you can't go where you want to go, go for a haircut, go to the pub, go for dinner, go get a wax, whatever, that's not restrictive. What we experienced was real restriction, and that's why we now can get away with not wearing masks, and we're walking around knowing that we're unlikely to catch it or spread it, not because it's a hoax.
Exactly. It's worth re-mentioning New Zealand, 5 million, right?
5 million.
Population of 5 million. Yes, it is a small country, but think of it as your city then, right? Think of it as your city in whatever country you're in. If 5 million is too small for a country, 5 million for a city, okay?
Yeah.
5 million population. It is 5th of July. And since the beginning of the pandemic, it has had only 1,533 cases in total since the beginning until now. 1,533. It has had 22 deaths, which every death is bad. It shouldn't happen.
Yeah.
But this is 22 deaths in 5 million. And how many active cases right now? 21 active cases. And that is why Beth was able to go get a haircut, dye her hair. That is why she was able to perform for 150 people. That is why tomorrow, if she feels like it, after work, she can go bar hopping, she can go shopping, you can do anything, everything.
Yeah.
Because the risk is low, and the risk is low because things were done.
Yeah. I know that if I go and hug my grandmother, I'm unlikely to kill her. Yeah. I don't know that I would be able to say that in any other country in the world right now.
Yeah. And that's where we are. We have evidence. There's still a lot of things that we're finding out. We know that.
Yeah.
It's a new virus.
It's a voyage of discovery, isn't it? We've never experienced this before.
Exactly. It's new. The virus is new. This whole experience, this whole situation that the whole world is in is new. But there are some things that have been a constant from the beginning. There are some things that there's more studies, and there's more proofs, and there's more, okay, yeah, this is what we thought, this is right. And one of the things is masks. So yes, there was a debate in March, April, even May about wearing the masks or not. But you just had to look at other countries, what they were doing, because your country was not the first one. The probability that your country was first, it's not, unless you're coming from China. And even then, there's like, it looks, etc. And we know that the main way that the virus transmits is droplets. So talking, screaming, singing, shouting, etc. And that's why it is recommended. Don't speak too loudly, and try to do so whisper or whatever, but try to do so with a mask. Because yes, the masks are do it yourself. Yes, the masks are cotton or some other material or so on, but by wearing them correctly, so over your mouth, over your nose, you are keeping those droplets with you.
Yeah, I mean, it's, you know, it's not fail safe. Of course it's not, but it minimizes your risk by 95%. I could be making that up. I don't know for sure.
Yeah, it depends on what mask and so on, but in general, you're saying it minimizes your risk, because if it transmits mostly by droplets, the little saliva that you're spitting around that you see and you don't see, that's basically what it is.
Yeah.
Then with a mask, you're keeping it.
Yeah.
And if you're sick, you already have it. So it's not that you're going to get sick by touching or inhaling or licking your saliva, right?
Yeah.
You got it there, but you are ensuring that you don't give it to the other person. And like you said, it's a real safe thing. This is not the solution. Masks are not the solution, but they're part of it. They are a piece of the puzzle to prevent transmission.
Yeah, I think one thing that is a barrier to people wearing masks is they struggle to understand that they're not wearing it to protect themselves. They're wearing it to protect others. And a lot of people really struggle to put themselves in other people's shoes or think about how their actions might affect somebody else. And how do you tell people how to do that? It's really difficult.
That's why some countries have handled it better. It's not only the leader that they have, and you know, but it's also countries or places where community is key. They've done better. Like look at New Zealand, look at Uruguay. So I call it the New Zealand of Latin America, because they're actually the only country in Latin America that are welcomed right now in the European Union.
Right.
And they've been doing well, and their lockdown was different. It was not a strict lockdown as yours, but it's very community based, thinking of others. You even have some states in the United States that think of the community. Alaska is one of them. That's why they're doing well. They're quite flat, and they're careful because yes, it's an independent state. Yes, it's lonely over there, and everybody's spread, so also that helps. But in general, there's this village mentality.
Yeah.
We all know each other. We need to think of each other, so I'll think of you. And that's exactly what the virus doesn't like, right? The virus loves selfishness, because then it can spread, because you're just thinking of yourself. So you're going to that party when you shouldn't be going to that party, and not socially distancing, because what you mentioned earlier, the best case scenario is 8 meters, right? Obviously it's difficult.
That's really hard. Yeah, I saw a thing from America. There was a bar that reopened, and from that one reopening, over 80 people got infected. And that's just, I mean, that's just it, isn't it? You know, just, yeah, people really struggle to think of anything other than their own wants and needs. The languaging in New Zealand throughout the entire lockdown was, we're a team of 5 million. You know, we're doing it together. We're doing it for each other. So everyone was really brought on board by the messaging that we received.
And it needs to continue. It needs to stay like that, because you were telling us, and we've seen and we know, although your concern 2 weeks ago was that, you know, all these people that are coming into New Zealand, there's a bigger risk. And thankfully, you were proved in a way wrong, because yes, the risk was there, but the actions was, you know what, triple the testing, you know what, get stricter. No, can't give an exception to this person for whatever motive. And so things are good. You can still go and do your own thing. So it doesn't matter what country you're from, even if things are good, you can't just say, oh, we're good. Let's, you don't want to
Just forget about it all.
yeah, you don't want to, I don't know, you don't want to have the quarantine facility, or you want to go on a holiday. You know what? Sure, we're good. Just
Fine, yeah.
no, you still have to keep cautious. But
Yeah.
there's also the other part. If your country or your city is doing badly, that doesn't mean, you know what, we're doomed anyways, let's have a big party. No.
Well, no, it's, through the lockdown, I was really bored. By the end, I was so ready for it to be over. But I also don't want my elderly neighbours to die. So I'll stay at home.
And it's not only your elderly neighbors, as we've seen, it's anybody that knows and doesn't know that has a pre-existing condition.
Yeah, exactly. And, the chances of me dying from getting it are really slim. But I don't matter here. It's people who could die if they get it that matter.
It's people that, and I have a pre-existing condition but thankfully does not, at least for now, there's no connection whatsoever, right? But I've found out about this pre-existing condition from testing, and because finally I was like, no, I know there's something wrong, let's figure out what it is, a few years ago. But I've had it for much longer. So you have so many people that do have a pre-existing condition and they don't know.
I have no idea. Yeah,
exactly. And that's why you need to be careful, and you need to know your country is doing well, it needs to keep doing well. Your country is doing poorly, like I said before, that doesn't mean it's doomed and you know what, let's have a doomsday party and who cares? No, you can turn things around. That's what the pandemic has shown us. Whatever actions you do today, you will see the consequences of it in 14 days and more. That means your city, your country is doing badly, your community, start making the changes now. Start socially distancing now. Start wearing the mask now, hygienically, properly. So not on your neck, not just halfway. Do it well. If they're one use, throw them away. If they're, you can use them more times, wash them. Don't just have them in your bag with your keys and your coins and everything, and then just grab it.
Hanging off one ear. Oh. Yeah.
So all these little things, when they're combined, washing your hands, so on.
Tracking where you've been.
Exactly. Knowing, staying with your bubble. New Zealand had the people that you can hang out with, right? And keep the same, keeping the same connections, basically. Do the same. If you have a couple of friends that you're always together and you're all like, relatively cautious or the same amount, stay with them. Why are you going to go with some random person that 2 weeks ago you weren't even thinking about? Why are you thinking about them?
Well, yeah, I mean, every person you hang out with, you're hanging out with every person that they've hung out with in the last couple of days, and every person they've hung out with in the last couple of days, and it's exponential. And if you're a social person, how many people do you see? How many people do you walk past in a shop? It's huge.
It's huge. It's huge. And we know the ways that are evidence. The evidence says how you get it. It's mostly through contact. It's mostly through droplets. So minimize the risks, right?
Yeah. And then you can perform and get a haircut.
Exactly. And then you can be sitting in Beth's place and be saying, look at me, I can do all these things because...
Feeling very smug,
And then on this side of the screen, we can be like, oh, I want that haircut. I want to perform. I want that drink. Say, we can change it. We need to sacrifice like the 5 million did. And we can do it. Beth, I feel our conversation went a little bit nerdy.
A little bit.
But I liked it.
Yeah, it's good.
But before I ask you my last question,
Mm.
do you have anything else that you would like to comment or say? It doesn't have to be about New Zealand. It can also be about the UK or even the world if you want. That has happened, or I don't know, how your family and friends that are in the UK, for instance.
Yeah, I mean, it's really hard watching people experience what they're experiencing from somewhere where I'm having a totally different experience. You know, my mum lives in a beautiful cottage in the middle of nowhere, and she's looking after herself really well, but she lives alone and she's unlikely to see another person until there's a vaccine. And that's really hard to deal with. You know, knowing that she won't be able to hug anybody, or, you know, all of those lovely things that you want to do, she won't be able to do them. And even though the government says, yeah, fine, go to the pub, it doesn't mean it's actually okay to. So do it for my mum so that she can give someone a cuddle.
Yeah, exactly. Do it for others. And like you
Yeah.
said, just because you need to know your own risk. So science and governments can tell you one thing, but so scientists from different, because you unfortunately do have some scientists that are more giving the recommendations because either to help the economy, to help the governments, right? In a sense, it's an unfortunate reality. So it doesn't mean that you need to do, you know, pubs are open, doesn't mean you have to go for a drink. You have to see the
Think for
situation,
yourself.
think for yourself, because you need to think of others, right? And yourself. Beth, last question. Last time we left, that I asked you to leave a message to your future self, which you did. Now I'm asking, based on this storytelling experience that you've had with me, with 14 days to change, and you've seen how things have changed in 14 days. And we spoke about the different measures that the UK and New Zealand did. So we really spoke about your experience, but what has happened since the beginning of the pandemic. And now we spoke about what is still happening, unfortunately, and what is going on in the world, 5th of July. Based on all these things, if you could tell, if you could give a message to the people that will be watching, will be hearing these series, this episode stories, and it doesn't matter if they're coming from a country that's worse off than New Zealand, or even better off, or even in New Zealand, you know, like a town nearby, what would you tell them? Is there something that you'd like to share?
I think it's probably come through quite a lot through our conversation, but think about other people. You know, you might be a very healthy person who is unlikely to be affected by virus, but there are so many that aren't in that fortunate situation that you could be putting at risk by doing what you want to do. So please, before you make any decisions, no matter how minor they may seem, think about everyone else that you could come into contact with, whose life you could potentially end.
Yeah, straightforward, realistic, and the unfortunate truth, right?
Yeah, you know, it's not just it's not something to say to upset people. It's the reality. You know, you could kill someone by going to the pub.
It's all about risks. Outdoor, if you're outside with your friends and you're socially distancing and you're moving, it is, and you're wearing masks and so on, it is less likely for you to get it. So it's more okay, such bad English, but it's more okay outside in that scenario than be crammed in a small pub with no social distancing, no mask, screaming, singing, talking, getting drunk, and risks, right?
Yeah, think about the risks.
It's the risks, thank you very much. It has been lovely and interesting and funny and everything in between, and sad, talking to you about New Zealand, the UK, your story, and the changes in the last 2 weeks.
Yeah, I've really enjoyed it. Thank you.
Thank you. So 14 days to change. This was Beth, New Zealand, with a tiny bit of UK talk. And that's it. Thank you very much. And
Thank you. Bye.